Let's start with anxiety. Anxiety is like a slow burn. It creeps in with worries, tension, and a sense that something bad might happen. It's future phonics. Your brain is playing the what if game. What if I fail? What if something goes wrong? It builds gradually. You may notice physical symptoms, tight shoulders, headaches, trouble sleeping, but they're all linked to that mental loop of worry. Now, panic is a whole different beast. A panic attack doesn't ask permission. It comes out of nowhere like a wave crashing over your head. One minute you're fine, and the next you're dizzy, can't breathe, and feel like you're dying. Your body goes into full emergency mode. It's intense, it's sudden, and often it doesn't have an obvious trigger. Timing and build up are key clues. Think of it this way: anxiety builds. Panic hits. Anxiety is like slowly climbing a hill with a heavy backpack. Panic is like being thrown off a cliff without warning. That difference in timing and intensity can help you tell them apart. In a world that thrives on noise, whether it's the constant buzz of technology, the chatter of social media, or the demands of everyday life, we often forget the true power of silence. It's easy to assume that silence is simply the absence of sound, a void that we need to fill to feel comfortable. But what if we stop seeing silence as something empty or void of meaning, and instead recognized it for the profound force that it truly is? Silence isn't just a lack of noise. It's a space in which we can reconnect with ourselves, recharge our mental batteries, and rediscover clarity. In fact, silence is a crucial tool for our emotional and mental well-being. It provides a break from the overwhelming stimuli of the world and offers us a moment to pause, reflect, and reset. Think about it for a moment. How often do you find yourself craving a moment of quiet? Whether it's stepping outside for a breath of fresh air, sitting alone in a room with no distractions, or even walking through nature with no sound except the rustle of leaves. These moments of silence can feel like a gift. In these moments, we can hear our thoughts more clearly, we can listen to what our hearts are saying, and we can become more aware of the thoughts and feelings that often get drowned out in the noise of everyday life. The power of silence is not just in its ability to quiet the mind, though. Silence has a unique ability to sharpen our focus. When we remove external distractions, we give ourselves the mental space to truly engage with our thoughts and feelings. We are able to confront the things we often push aside in favor of noise: our fears, our desires, our dreams, and our anxieties. In silence, we can process these emotions in a way that might not be possible when we're constantly being bombarded with information. Moreover, silence has the power to promote mindfulness. It allows us to be present in the moment, fully immersed in whatever we are doing. Whether you're taking a walk, reading a book, or having a conversation, silence encourages you to be in tune with your surroundings and your internal world. Without the constant interruptions of notifications, background noise, or the pressure to keep up with everyone else, you can be more grounded in the present moment. And when you are present, you are more connected to yourself, to others, and to the world around you. Another powerful aspect of silence is its ability to foster creativity. It might seem counterintuitive. After all, creativity is often associated with brainstorming, collaboration, and speaking up. But some of the most profound ideas come in moments of stillness, when the mind is free from external pressures. Think of the countless times you've had a breakthrough while taking a walk in silence, or during a quiet moment before bed. It's in these moments of peace that our brains are able to make connections and form new ideas. And silence doesn't just benefit the individual. It can also be incredibly powerful in our interactions with others. In conversations, silence can be a tool of empathy and understanding. It allows space for reflection, for active listening, and for deeper connection. Instead of filling every moment with words, silence in a conversation can show others that you are present and that you value what they have to say. Sometimes it's in the silence that the most meaningful communication happens, when words are unnecessary and our shared humanity speaks volumes. But perhaps one of the most important things silence offers is a break from the constant pressure to perform, to be productive, and to keep moving at a frenetic pace. In a society that often equates busyness with value, silence reminds us that we don't always need to be doing something to be worthy. It encourages rest, reflection, and rejuvenation. In silence, we reclaim our sense of agency and recognize that our worth isn't tied to our output or our external accomplishments. It's inherent simply because we exist. For many, the idea of silence can be uncomfortable. It can bring up feelings of loneliness or anxiety, but these feelings are often a reflection of our disconnection from ourselves, from our inner peace. When we learn to sit with silence, we begin to understand that discomfort is not something to avoid, it's something to embrace. Silence invites us to become comfortable with stillness and uncertainty, and in doing so, we begin to unlock a deeper sense of strength and resilience. Silence is also a powerful tool for healing, whether you're grieving, processing a difficult experience, or simply trying to regain your emotional balance. Silence allows space for those emotions to surface. It offers a sanctuary where we can confront our pain without the distractions of the outside world. In the stillness, healing begins. It's a quiet yet transformative process that doesn't require words or external validation. It's simply an internal journey that happens when we give ourselves the permission to rest and reflect. So, next time you find yourself seeking silence, don't dismiss it as a lack of action or a void to be filled. Instead, recognize it as the potent tool it is. Silence is not an absence, it is a presence. It is a space for growth, for reflection, for creativity, and for connection. It is the quiet power that allows us to hear ourselves, to understand others, and to embrace the world with a deeper sense of purpose. Panic is not something that builds over time, gradually wearing us down. No, panic strikes like a lightning bolt, sudden, intense, and overwhelming. It's like a force of nature that appears without warning, crashing into our bodies and minds with no regard for what we were doing just moments before. It's a beast that takes over in an instant, leaving us feeling powerless and out of control. But unlike anxiety, which is often rooted in worry or fear of the future, panic attacks can occur without any clear reason, often catching us completely off guard. Imagine for a moment you're going about your day. Everything seems fine. You're sitting at your desk, having a conversation with a friend, or simply walking down the street. And then, out of nowhere, a wave of terror hits you. Your heart starts pounding uncontrollably, your chest tightens, and your breathing becomes shallow. You feel dizzy, lightheaded, and as if the world around you is closing in. Your mind races with thoughts like, what's happening to me? Is something seriously wrong? It feels as though your body has gone into full emergency mode, even if there is no apparent reason for it. The experience of a panic attack is frightening, not only because of the physical sensations, but also because of the psychological terror it creates. Your brain, flooded with adrenaline and stress hormones, sends signals to your body that something is dangerously wrong, even if you are in a completely safe environment. It's as if your body has activated its fight or flight response without any real threat present. You may begin to feel trapped within your own body, like you can't escape what's happening to you. And that sense of entrapment only amplifies the panic. One of the most unsettling aspects of panic attacks is how quickly they escalate. What starts as a small tremor or slight discomfort can spiral into full-blown terror in just a matter of seconds. Unlike anxiety, which can give you time to prepare for the worst or try to manage your thoughts, panic doesn't wait for you to gather yourself. It hits you with such intensity that your brain has little time to process what's happening, let alone make sense of it. The physical symptoms of panic attacks can be alarming too. Heart palpitations are often one of the first signs that something is wrong. This can feel like your heart is racing, skipping beats, or even pounding so hard that it's painful. Many people mistake this sensation for a heart attack, which only adds to the fear. Along with the heart palpitations, you might experience shortness of breath, a choking sensation, or a feeling that you can't take in enough air. It's as though your body is suffocating, and every breath you try to take only increases the anxiety. The timing of a panic attack is like being blindsided. You might not see it coming, and you certainly won't have time to prepare. One minute, everything seems perfectly fine. The next, your heart rate skyrockets, your breath becomes shallow and rapid, and you may experience symptoms like dizziness, chest pain, or numbness. It's fast, and it's intense. There is no warning, no slow escalation. Panic, by its nature, is unpredictable, and this unpredictability is one of the defining aspects that separate it from anxiety. What makes panic attacks particularly distressing is that they often happen out of the blue. You might be caught in a moment of calm or engaging in a normal activity when suddenly your body is overtaken by this overwhelming feeling of fear. The experience can be jarring, as if your body is reacting to something life-threatening when nothing in your environment has changed. This is what causes the confusion and terror, the sudden and intense physiological response to something that seems completely out of place. The lack of a clear trigger or gradual build-up means that panic attacks can be incredibly frightening. You don't always know when they'll occur, and this uncertainty makes them harder to manage. Unlike anxiety, where you can sometimes trace the cause back to a specific worry or stressor, panic often seems to appear for no reason at all. This can lead to a fear of having a panic attack in situations where you feel trapped or vulnerable, like being in a crowd on public transportation or at work, which can then lead to avoidance behaviors. You might start to avoid places or activities that you associate with previous attacks in an attempt to prevent the next one. This cycle of avoidance can create further anxiety and stress, reinforcing the power panic has over your life. Because panic strikes without warning, the key to managing it often lies in understanding the experience and recognizing that, while it may feel uncontrollable, it is temporary. A panic attack might feel like it lasts forever, but the truth is, most panic attacks peak within 10 minutes and begin to subside after that. The key is not to fight the panic, but to recognize that it will pass. Remind yourself that even though it feels like you're in danger, you are safe. This understanding can make a huge difference in how you approach a panic attack when it arises. When we examine the timing and build-up of both anxiety and panic, it becomes clear that anxiety provides you with more time to react and manage your feelings. It offers you a chance to recognize the warning signs and apply coping strategies before things escalate. Panic, on the other hand, is swift, intense, and disruptive with little to no time to prepare. Recognizing this difference can help you understand why it feels so difficult to manage a panic attack and why the strategies for coping with it are different from those for anxiety. In both cases, awareness of the timing, whether it's the slow build of anxiety or the sudden onset panic, gives you insight into how to respond. With anxiety, you have time to intervene before it overtakes you. With panic, the goal is to accept its presence without letting it define you. By understanding the timing and build-up, you can better prepare yourself to cope with each experience, even if the two feel so different in their nature. Both anxiety and panic are responses to stress, and both are completely manner. When we experience anxiety or panic, our bodies undergo a series of physical reactions that are part of the body's natural response to stress. In both anxiety and panic attacks, you may notice symptoms like increased heart rate, tightness in the chest, shortness of breath, and even dizziness. These physical symptoms are a result of your body activating its fight or flight response, which is meant to prepare you for perceived danger. In both cases, your body is trying to protect you. However, the way these symptoms manifest in each situation can differ significantly, particularly when it comes to intensity and duration. Let's start with the basics. Both anxiety and panic activate the autonomic nervous system, which controls involuntary bodily functions like heart rate, breathing, and digestion. This system is responsible for your body's response to stress. In both anxiety and panic, this system goes into high gear, triggering the classic fight or flight response. This is why you might experience similar physical symptoms, regardless of whether you're dealing with anxiety or panic. Increased heart rate. One of the most common physical symptoms in both anxiety and panic attacks is an increased heart rate. Your heart might begin to race or pound in your chest, and this can be distressing. The difference between anxiety and panic, however, lies in the intensity of this sensation. With anxiety, your heart rate will typically increase gradually as your thoughts and worries build. It's uncomfortable, but not usually overwhelming. In a panic attack, on the other hand, the heart rate spikes suddenly and intensely, often feeling like your heart is beating so hard it's about to burst out of your chest. This intense sensation can create even more fear, which only adds to the panic. Shortness of breath. Shortness of breath is another symptom that can occur in both anxiety and panic attacks. When we feel anxious, our breathing can become shallow or rapid as our bodies prepare to either confront a threat or flee from it. In anxiety, the shortness of breath may be mild, but it's usually manageable. It can feel like you're out of breath or like you can't fully catch your breath, but you can still breathe steadily with conscious effort. During a panic attack, however, shortness of breath can feel much more extreme. It might feel like you can't get any air at all, or that you're suffocating. This can trigger even more anxiety, compounding the panic attack and making it even more difficult to calm down. Chest tightness. Chest tightness is a symptom that many people report during both anxiety and panic. When you're anxious, you might feel a pressure or discomfort in your chest. It's as if your chest is heavy or tight, often accompanied by a feeling of unease or restlessness. This sensation can be worrying, but it's usually not debilitating. With panic, however, the tightness can become much more severe and intense, often causing people to fear that they're having a heart attack. The pressure can feel suffocating, and it's often accompanied by a feeling of impending doom. The intensity of chest tightness during a panic attack is far more overwhelming than with anxiety, making it more frightening for those experiencing it. Dizziness and nausea. Dizziness, or lightheadedness, is another physical symptom that can appear during both anxiety and panic. During anxiety, this symptom is usually mild and may happen if you're feeling overwhelmed or physically tense. It can feel like a bit of vertigo, or like the world is spinning around you. You might also feel a little off balance, but it's usually brief and passes as the anxiety lessens. In panic, however, dizziness is often much more intense. It can be accompanied by nausea, a sense of losing control, and the fear that you might faint or collapse. This dizziness can feel disorienting, and it's one of the reasons why people experiencing a panic attack often fear that something is seriously wrong with them, even though there's no real danger. Tingling or numbness. Many people who experience anxiety or panic also report sensations of tingling or numbness, often in the hands, feet, or face. This can happen because of hyperventilation, rapid breathing, which reduces the amount of carbon dioxide in your blood and causes these sensations. With anxiety, this tingling is usually mild and doesn't last long. It might feel a bit uncomfortable, but it's not usually alarming. With panic attacks, the tingling can be much more pronounced and widespread, leading to a heightened sense of fear. It's not uncommon for people to believe they're having a stroke or another medical emergency when this happens. The intensity and duration of tingling during a panic attack can make the experience far more terrifying. Duration of symptoms. While the physical symptoms of anxiety and panic overlap, one of the biggest differences is the duration of these symptoms. With anxiety, the symptoms can last for hours, sometimes even days, especially if the anxiety is tied to an ongoing stressor like work or relationship issues. The symptoms tend to wax and wane, gradually intensifying and then subsiding depending on the situation. You might feel anxious on and off throughout the day, but you can usually find ways to manage the physical discomfort through relaxation techniques, exercise, or other coping strategies. Panic, however, is more intense and short-lived. Panic attacks tend to peak quickly, reaching their most intense point within 10 minutes or so, and then gradually taper off. Most panic attacks last anywhere from 5 to 30 minutes, though they may feel much longer while they're happening. The physical symptoms can feel overwhelmingly intense during the peak of the panic attack, but they usually subside as the body's fight or flight response diminishes. While the physical symptoms of panic may subside quickly, the emotional aftermath, such as fear of the next attack, can last much longer. In short, while anxiety and panic share many physical symptoms, it's the intensity and duration of those symptoms that set them apart. Anxiety symptoms tend to be more manageable, gradually increasing in intensity and giving you time to respond, whereas panic attacks strike suddenly and intensely, often overwhelming you with their intensity. Understanding these differences can help you recognize what's happening in your body and give you the tools to respond more effectively, whether you're when anxiety or panic strikes. It's easy to feel like you've lost control. Your body is reacting in ways that can be confusing and overwhelming, and your mind races with worry. But what many people don't realize is that there are simple, effective tools you can use to regain a sense of control and calm. Among the most widely recommended and effective tools are grounding techniques and breathing exercises. These practices may seem simple at first, but they hold tremendous power when it comes to managing intense emotional and physical experiences. Grounding techniques. Bringing you back to the present moment. Grounding techniques are exercises that help you reconnect with the present moment when you're feeling overwhelmed by anxiety or panic. When you experience anxiety or panic, your body is often reacting as though you are in immediate danger, even if there's no actual threat present. This disconnect between your body's response and your reality is one of the things that makes these experiences so distressing. Grounding exercises help you to reconnect to the here and now, making it easier to calm your mind and body. One of the most well-known grounding techniques is the 5-4-3-2-1 method. This technique engages all your senses, which can help distract you from your racing thoughts and bring you back to reality. The method is simple: 5 things you can see. Look around you and identify 5 things. It could be a chair, a lamp, or a flower in the room. Focus on the details of each object, such as its color, texture, or shape. 4 things you can touch. Notice 4 things you can physically feel. You might touch the fabric of your clothing, the ground beneath your feet, or the texture of an object in your hands. 3 things you can hear. Pay attention to the sounds around you. You might hear the hum of a fan, the birds outside, or the faint rustling of trees in the wind. 2 things you can smell. Close your eyes and breathe in. Focus on any sense in your environment, whether it's the smell of fresh air, your perfume, or the aroma of coffee brewing nearby. 1 thing you can taste. Finally, notice the taste in your mouth. Maybe it's the lingering taste of a drink, a snack, or just the sensation of your tongue in your mouth. This grounding technique works because it forces you to focus on the present moment, using your senses to draw you away from the overwhelming anxiety or panic. By engaging with the world around you in a mindful way, you can stop the spiraling thoughts that often make anxiety and panic worse. It can feel like a simple shift, but this practice can bring significant relief by grounding you in reality. Another effective grounding technique is the anchor method. which involves using an object to center your focus. Choose an object you can carry with you, or that's easily accessible, like a stone, a key, or a piece of jewelry. When anxiety or panic hits, hold the object in your hand, close your eyes, and focus on how it feels in your hand. Concentrate on its texture, temperature, and weight. This simple action can provide a sense of security, making you feel more rooted in the present moment and less overwhelmed by the feelings of panic. Breathing exercises. Harnessing the power of your breathing exercises are one of the most accessible and effective coping tools for managing anxiety and panic attacks. The reason they work so well is simple. When we feel anxious or panicked, our breathing becomes rapid and shallow. This fast, shallow breathing activates the body's stress response and can actually make the symptoms of anxiety and panic worse. By consciously slowing down and controlling your breath, you can send signals to your brain that it's time to calm down, helping to reduce the intensity of the physical and emotional symptoms. One of the most well-known breathing techniques is diaphragmatic breathing, also called deep breathing. This technique focuses on slowing your breath down and breathing deeply into your diaphragm, rather than taking shallow breaths from your chest. To practice diaphragmatic breathing, follow these steps. Find a comfortable position. Sit or lie down in a comfortable position with your shoulders relaxed and your hands resting on your abdomen. Breathe in slowly. Take a slow, deep breath through your nose, allowing your abdomen to rise as you fill your lungs with air. Try to breathe in for a count of 4. Hold your breath. Pause and hold your breath for a count of 4. This helps to center your mind and prepares your body to exhale slowly. Exhale slowly. Slowly release the breath through your mouth, making a soft shay sound as you exhale. Try to exhale for a count of 6, making sure to empty your lungs completely. Repeat this process several times, aiming for 5 to 10 deep breaths. With each breath, allow your body to relax and your mind to focus on the sensation of your breath moving in and out. This technique is highly effective because it slows the heart rate, activates the parasympathetic nervous system, the part of the nervous system that calms you down, and helps restore a sense of balance to both body and mind. Practicing diaphragmatic breathing regularly can also help reduce overall anxiety and make you feel more in control of your emotional responses. Another simple yet powerful breathing technique is 4-7-8 breathing. This method helps calm the nervous system quickly and is especially useful when you're feeling overwhelmed. Here's how to do it. The power of mindful awareness. Both grounding and breathing exercises have the common thread of mindful awareness. They encourage you to step outside of your racing thoughts and physical symptoms and focus on what is happening in the present moment. Mindfulness is the practice of being fully engaged in the here and now, without judgment or distraction. In times of anxiety or panic, mindfulness helps you observe your thoughts and physical sensations without becoming consumed by them. This practice allows you to experience what you're going through without letting it define you, which can significantly reduce the feeling of being overwhelmed. Why these tools work. The reason grounding and breathing exercises work so effectively is that they engage the brain's ability to focus and self-soothe. When you're in the midst of an anxiety or panic attack, your brain goes into overdrive, interpreting everything around you as a potential threat. By practicing grounding and breathing techniques, you disrupt this automatic response, shifting your focus to something calming and tangible. You're signaling to your brain that it's safe to relax, and that the feelings of fear or panic can be let go. Over time, with regular practice, these techniques can become second nature, helping you manage anxiety and panic more effectively. While anxiety and panic attacks can be incredibly overwhelming, it's empowering to know that grounding techniques and breathing exercises are simple but highly effective tools for regaining control and calming your mind and body. They don't require special equipment, and they can be practiced anywhere, anytime. Whether it's grounding yourself through sensory awareness or calming your nervous system with deep breaths, these coping strategies help you stay connected to the present moment and break the cycle of overwhelming thoughts and physical symptoms. By incorporating these tools into your daily life, you'll not only have effective ways to manage your anxiety,